profits. Medicare for all. Patients, not profits. Medicare for all.
We appreciate it.
Patients, not profits.
The crowd looks good. And I think it's probably better we have more room on this side than we would over there where all of that construction is going on. So this is as good a place as any to stage this. While we're at it, I might as well tell you a little bit about a program called ACO REACH. And I may be getting into the weeds here. It's difficult, but it's another form of privatization. The Center for Medicare and Medicaid Innovation has pilot programs, and in this pilot program, they are putting out contracts to venture capital, to private equity, and to healthcare insurers. And what they do is they take people who have chosen traditional Medicare, and without their consent, they place them into this program and then begin payment at a monthly rate to these companies that run these plans. And Humana is involved in these. Humana has places called Centerwell, and they've been opening them in town here, and I think one in Lexington. And there are places here in town that are called Oak Street. All of those centers are clinics that are a part of the ACO REACH plan. Meaning if you go to those doctors or nurse practitioners usually, you will then be aligned into that particular program. And unlike Medicare Advantage, where they take 15% in overhead and profit, in ACO REACH, they take from 25 to 40% in overhead and profit. It's another form of privatization. It is without the consent of the people who are involved, and the money is paid monthly in a capitated rate to Oak Street, to Centerwell, to Humana, to these other entities. We have more. There's Village MD, that's in Murray, Kentucky. There's Illumed, that's in Pikeville. They're all over the country, and they are a plan and a privatization that even takes more money out of our healthcare system and puts private equity into the driver's seat so that they are able to come in and use their power to take the public money. They're getting so much money from these privatized plans that Humana is now in the process of dropping their employer-based care because they get so much from the public plans that they don't want to deal with the little ones. They call it the cash monster. It was revealed in the New York Times in October 8 of 2022 that the cash monster is insatiable. And a tremendous amount of money that is our public money goes into that, and they take it away from the care. For all of us, every week that we work, there's money that comes out of our paycheck to provide for Medicare. Money from the worker and money from the employer. That money goes into the Medicare Trust Fund. It's supposed to be there so that when we are retired and no longer have employer-based insurance, we will then be provided with Medicare, a public plan. But that fund is being plundered by Humana and Aetna and Cigna and United Healthcare and all of these insurance companies who care not for patients, but who care for the profit that they get from it. So that's why we're here. We think it's a little bit complicated. which is one of the reasons why we're struggling to mobilize the people of the nation. But you know, we do have majority support for national single payer, for an improved Medicare for all system. Our people really do want everybody to have coverage. They really, really do want the barriers to care to be removed. I mean, we got the Affordable Care Act, and it changed a little bit, and it expanded Medicaid, but it's still way too expensive. So we went from a situation in which we had close to 50 million uninsured. Now we have many more than that who are underinsured, who cannot afford their care despite having a nominal insurance plan. So that's the fight. You know, it's the fight in every union contract, because unions have had the burden to negotiate with insurers and with employers to make sure that their workforce is provided for. And it gets harder and harder to do that. So for many years now, we haven't been able to advance wages and other benefits because all the strength that we had to go into the effort to assure that we kept up with covering people for health care. We have to stop it. We cannot continue to have a system where we pay double what the other wealthy countries pay, and we get less. You know, one of the tragedies that we face now is that life expectancy is declining in our country. We are now something like 6 years behind Italy and other countries. That hasn't happened. You know, the history of our country was things got better, and we were, you know, doing better in life expectancy. We're going backwards now. So it shows that people are not able to live full lives. Patients, not profits. Medicare for all. Patients, not profits.